afternoon, welcome to Head and Living on ITV. I am Blessing H. We apologize for coming behind schedule. You know, sometimes a man plans and then things just happen. Good news is that I have two doctors for you today, and we're looking at something that concerns women majorly, but you know that when the woman is not happy, if she's married, her husband will not be happy. If she's a daughter to a father, that father would not be happy. And so if she's not happy, she has a brother, he too will not be happy. So I think it concerns everybody after all. My name is Blessing H. Like I said, I have two doctors for you today, and we're looking at fibroids. I've got Dr. Michael Ezeanoche, who is a consultant gynecologist of the University of Benin Teaching Hospital. Welcome to the show, sir.
Thank you, Blessing.
I also have the PRO of Nigeria Medical Association, Edo State Chapter, Dr. Emeka Oko. Welcome to the show.
Thank you very much.
Now, for these two doctors to leave their very busy schedule just to come talk about fibroid, it must be that is of great concern to the enemy and, of course, to doctors who want to educate women about it. Let's begin with Dr. Michael Ezeanoche. Fibroids, what is it actually?
So fibroids are a problem with women. Okay. Women who are usually in the age where they can reproduce. In lay terms, they represent an abnormal growth of the muscles of the womb. So in the womb or the uterus, we have muscle cells making them up. And they are programmed to grow in a certain way. When they start growing abnormally and become excessively large and can become a nuisance, they are known as fibroids. So technically we say fibroids are benign tumors or growths of the womb of a woman or the uterus. Okay,
when you say benign, what does it actually mean?
So growths, or abnormal growths in the body that we call tumors, can be of two general types.
Okay.
They can be benign or those that are not cancerous. Okay. They can't spread. They grow locally where they are, and they can constitute a problem as a result of their presence and increasing size.
Okay.
But when such growths have the capacity to spread far to distant places outside where they started, and they can cause a whole lot of problems in the body, we call those ones malignant growth or cancers. So fibroids are not cancers.
Okay. All right. Being that fibroids are not cancers, how then does it manifest when a woman has fibroid growing in her? What are the signs that she would see or symptoms that she would feel?
So thank you for that question, Blessing. Fibroids are comparatively common conditions.
Okay.
It is commoner in women of African descent, Black Africans, compared to Caucasians or non-Black Africans. It is usually asymptomatic. So when they occur in a woman's womb, it doesn't give her any symptom.
Oh.
So she may go for a health check for another reason, and she does a scan, and then they say, oh, you've got some growths in your uterus and you have fibroids. When they are discovered in such manner, we don't really bother about them.
Okay.
When they cause problems for the woman, or when they produce what we call symptoms in medicine, some of the symptoms can be heavy menstrual bleeding.
Okay.
So you see the woman, the duration of the menstrual flow, or the amount of blood she loses in her menstruation increases, and she may be passing clots.
Okay.
Additionally, you may have, when they become very big, some swelling of the lower abdomen.
Okay.
Or the tummy starts getting bigger, and some people may think they're carrying pregnancies.
Okay.
Other symptoms that may be associated with the presence of fibroids in a woman will include pressure effects. So as it is getting bigger, it is compressing on structures nearby to the womb.
Okay.
So it could press on the bladder and makes her urinate more often.
Okay.
Or it could press on the anal canal where feces come out and can make it difficult for her to go to the toilet.
Okay.
And then it may also cause painful menstruation. So these are some of the common symptoms or effects that fibroids may have in a woman.
Okay. Now, we'll talk about the effects more, but let's go to treatment quickly. Dr. Emeka, I don't know if you've ever, maybe when you're driving through town, you've heard some persons who sell some medication in your vehicle or in marketplaces, and they begin to name different kinds of illness that they are medication is supposed to cure. I've heard sometimes they say, oh, if you have fibroid, if you take this, if you take that. Is fibroid something that, oh, you could just get a medication from anywhere and then it takes care of it?
Well, thank you very much for that question. It's quite pathetic that each time we go about our normal businesses of the day, we keep hearing a lot of people clamoring and making very loud noise, like perhaps I shouldn't mention names, educating the public falsely. They call a particular drug that addresses series of ailments. I think it is wrong, and I don't know what we are doing about that in our environment. And by the special grace of God, I'm sure the Nigerian Medical Association, Edo State, will put up something as addressed by the chairman, Dr. Mrs. Imoesili, the chairman, Nigerian Medical Association, to put a stop to things like that. I think what is actually effective and wise is that when a woman who has issues with her womb, for instance, the fibroid we are talking about, should present early in the hospital. And when the woman is investigated, and there are certain treatments that are advocated for this personality. It could either be surgery, depending on the symptoms, according to Dr. Michael Ezeanoche. It depends on the symptoms. If the symptoms are disturbing, we could decide to take off the fibroid. If the woman is perimenopausal, we could decide if the symptoms are lesser, to see if we can manage conservatively till it is well taken care of. So I want to admonish members of the public to try as much as possible to present very early in the hospitals, especially in the only fibroid, other ailments that has to do, that are debilitating to the human personality.
Okay, but since fibroid is something that doesn't really just give the woman symptoms, so wouldn't it not be very difficult for a woman to know if she has fibroid? Is it something that, oh, you just have to go to the hospital regularly for check? Is there a certain age that calls for such checks?
So if you look at the pattern of manifestation of fibroids in the general population, it is seen in women who are in the age of reproducing ability. So we're talking about women who have seen their menses and who are not yet in menopause. So for those kind of women, it is good that once in a while they should go for routine health check.
That once in a while, can it be like every 6 months or once in a year?
No, so for different age groups, there are different indications and different tests that are required for ladies to go on health checks. But certain populations, like people who have not had, who have delayed childbearing, or who have low number of children, their risk may be increased. But we generally ask women that at different phases of your life, when you get pregnant and you're planning to raise a family, see a fertility expert or a gynecologist, and these are part of the routine check that I may do for you to find out if you have fibroids or not. I just want to make a comment on treatment specifically. Like we said, majority of cases don't disturb and are discovered incidentally. For those kind of persons, treatment is expectant. You don't do anything for them. So many women, when they go to do ultrasound scans of the abdomen or the pelvis and they see fibroids, they panic a lot and they may resort to all kinds of medications and fall into the hands of persons who want to misinform or even obtain money from them in less than a dignified manner. Two, so when you get that kind of a diagnosis, see an expert who will let you know whether the fibroids are significant or deserving of treatment. Should you decide to treat, you could treat with drugs, or non-surgical treatment. There are drugs you can use to manage the fibroids, improve on the symptoms so that you can cope with it, or even shrink it. Then we have surgical management. So for those that are qualified in terms of the disturbance of the patient or the needs of the patient to do surgery, then you can operate on those kind of fibroids. And the surgery could be removal of the fibroids and reconstructing the uterus to its perfect shape, to enable the woman have more babies. These are for those who are desirous of having more children.
Okay.
Now, for the older woman over 40 or who have completed childbearing and says, I don't want to keep the uterus again and the risk of other problems that may arise from it, the surgery may be removal of the entire uterus itself.
Wow.
So there are different treatment options for different types of patients with different kinds of symptoms and fertility requirements. Okay,
Dr. Emeka, what if a woman, unknown to her that she has fibroid, gets pregnant?
Okay.
What could happen?
Well, there are situations whereby there could be coexisting uterine fibroid and pregnancies. So in that condition, we expect the woman to present early in the hospital for the experts to manage this patient till delivery. It is unexpected for such patients like we see in our society today. They eventually find themselves presenting in those people that seems to have the loudest voice, and which is what the chairman, Dr. Emoisili, is currently hammering on, that doctors, NMA, Edo State, should have the loudest voice in the society so that we'll be able to educate the people properly. We are ready to take medical practices to the common man so that they will get educated and know the exact thing to do as at when due.
Okay, we'll open our phone line so that you can call if you have a question to ask our doctors here in the studio about fibroid. But do you think that part of the reason why those persons who you say seem to have the loudest voice because, sometimes they have loudspeakers actually reaching out to lots of people about drugs that they claim can take care of fibroid is because it's cheap? Because you find them mostly at marketplaces, and you find women rushing to them to get such things from them. Dr. Emeka. Okay.
So in terms of access to treatment, medicine is a very scientific and highly regulated profession. You cannot pick any treatment option that has not been proven to be scientifically effective and sell to the lay population who are potentially gullible in terms of medical knowledge. So that makes it a bit difficult for doctors to market anything that is not proven and collect money by trickery from the general population. So whatever you are allowed to present to a patient as a treatment modality for fibroids or any condition must be independently proven to be true. And then two, even while you're offering healthcare service to the general population, you are not allowed to self-advertise or seek glory. So that also creates a limitation to the extent that doctors can push forward scientific information for patients. But that's why we're partnering with ITV to ensure that people get the right information about where to go to if they have some of these questions. And in terms of pregnancy, fibroids can coexist with pregnancy, and it may be entirely harmless. So women do not need to panic unduly. But you may have fibroids in pregnancy located in certain areas that can pose a problem. But the point is that if you have fibroids, seek information and advice from a competent health professional to let you know whether there is no reason to be alarmed or the kind of treatments you will need. I think that should be the core message for everybody.
Now, is fibroid preventable? Is it something that you could say if you do this, if you do that, then you would not have fibroid?
Fortunately, there's no evidence in terms of science to tell us that this intervention or this activity can prevent fibroids.
So there's virtually nothing a woman who's of childbearing age can do. It's just something maybe you hope you don't have.
Well, yeah, I'll put it that way. In terms of our counseling and in terms of scientific evidence, there's really nothing that has been proven to say if you do this, then you won't get fibroids. But there are risk factors, like I said, if you delay childbearing for too long, or if you have very low number of children, it's been associated with an increased risk of getting fibroids. So, in a way, early childbearing or spacing your children evenly so that you don't technically leave the womb idle for too long may reduce the risk. But I'm not saying it will prevent it, but it may reduce the risk.
The number to call is on the screen. You can call in right now so that we'll direct your question to the doctors, anyone that you actually will. Okay, just call in and then the doctors will answer your question. But I want to know if fibroid is treated either by drugs or by surgical treatment. Is it something that will cause, Dr. Meka?
Well, it has not been proven that when fibroid is treated surgically that it cannot reoccur. There's every tendency that it may reoccur.
Okay.
But it takes time. Most times after surgeries, we usually advise our patients to see what they can do in terms of to abort nulliparity. Nulliparity in the sense that ensuring pregnancy.
Okay.
But I don't think, I must put it to you that it's not something that is proven that when it has been taken off, it will not reoccur. It may reoccur.
Any lifestyle modification for a woman who has fibroid? Okay, we have a caller on the line. Hello.
Hello, good afternoon.
Good afternoon. Welcome to Healthy Living.
It's Albert Homer.
Okay, welcome to the show. Go ahead, ask your question.
I appreciate you for the knowledge.
Thank you, too, for watching.
I observed that some persons, because what they want to say there, that older person, they have a fibroid. But I've seen some people who have not even given birth, they are having fibroids. What could be responsible for it?
Okay, thank you. Just keep watching. You heard his question. He said older persons, you said older persons. I think maybe he got it mixed up somewhere. But he's seen some young persons who have not given birth having fibroid.
So for emphasis again, I would say fibroids is seen in women who are in the reproductive age range.
Okay.
Any woman who has started menstruating
okay.
and who has not reached menopause
okay.
has a risk of developing fibroids. But if you stratify them to the young and the elderly, the risk is higher in the older woman who has not given birth before or who has very low number of children compared to those who are younger or those who are giving birth. So yes, people less than 30 can get fibroids too.
Okay, so I think that's clear. Hello. 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 Okay, we lost that call. The number is on the screen. You can call in now to ask your question. Hello. I think your TV is too loud, or you need to move away from it.
Okay, let me get a bit out of where my TV is.
Okay, what's your name? Yes, I can hear you. Go ahead.
Okay, good afternoon. My name is Hope.
Okay, welcome to the show.
I just tuned in now, and I'm very interested about the topic.
Okay,
so
go ahead.
So my question is this to the doctor. What about somebody who, like myself, the doctor said the fibroid I have is just too small, that when he takes my tummy, that he's not feeling that much. So what could be responsible that I could not, nothing passes in, I can't get pregnant with it?
Okay, thank you, Hope. Just keep watching. All right.
So we could see from the image that is showing on the screen,
yes,
there are different locations where you can have fibroids.
Okay.
But I want to emphasize, if fibroids are discovered incidentally and are not giving you any symptoms, generally we don't rush to treat.
Okay.
However, in certain situations, fibroids may be associated with delay in getting pregnant.
Okay.
Usually, a woman who's having delays in getting pregnant and has fibroids, it may not necessarily be the fibroid that is causing the delay in getting pregnant. There are other conditions that she needs to see a doctor, and they will investigate and find out whether she has those conditions, like polytreated sexually transmitted infections or tuber block or low sperm count.
Okay.
But in the few situations, fibroids may cause delay in getting pregnant, especially if they are located close to the entrance to the womb.
Okay.
And they block the fallopian tube, making it difficult for the eggs from the woman to meet with the sperm coming in from the vagina. So in those cases, fibroids should. But a woman who has fibroids and has delay in getting pregnant, she should an expert, a gynecologist. They will assess her and give her the appropriate treatment.
Okay, we'll just make room for one last call. Hello.
Hello.
Hello, welcome to the show. What's your name and where are you calling from? Your TV is too loud, please. Move away from it or turn it off completely. Okay, we were talking about lifestyle modification. Should a woman who has fibroid modify a lifestyle?
When we say lifestyle modifications, we may need to look at it again specifically, what we're talking about. But yes, if you have fibroids and you're having symptoms, if your menstruation is heavy, then you may need to be on.
Okay, let's. Oh, it seems there's some problem with network. Let's see if we can get one last call. Hello. All right. Hello. Hello.
Hello, good afternoon.
Good afternoon. What's the name? Where are you calling from? Hello, go ahead.
Okay, please, before my delivery.
Before your what?
Delivery.
Okay.
And show that there's a fibroid.
Okay.
So I was scared, but at the end of the day, I had a normal delivery. And the size of the fibroid was 9 point something. So after delivery, I went back again after 4 months to check. It was now 5 point something. So for 2 weeks now, I noticed that after my period, the blood is not stopping. It will be as if it wants to stop. But it's now the brown and dark. As if it wants to stop. Before you know, it will start again red.
Okay.
After 3 days again, to go as if it wants to be black like.
Okay, so you want to know what's happening.
For 2 weeks now.
Okay, all right. So doctor,
I don't know.
This is her experience.
So abnormal menstruation, heavy menstruation may be associated with fibroids.
Okay.
And even if you have fibroids in pregnancy, I told you before, it doesn't mean it may be a problem. So what she needs is to see a gynecologist who will assess her and advise her on the best treatment from the treatment options that are available.
Okay. So lastly, before we go, is there anything, we're talking about lifestyle, are there foods she should avoid, a woman who has fibroid, things she should avoid doing not to complicate the condition?
In terms of overall lifestyle, it doesn't require any lifestyle changes, but you may need to have, modify certain things if you have symptoms. If you are losing blood a lot from menstruation, you may need to have a good diet, and you need to be on supplements and blood supplements, or you may need to be on painkillers and all that. So those are the minor things you need to do. Okay,
thank you very much, Dr. Michael Ezeanochi, consultant gynecologist from the University of Benin Teaching Hospital, and also Dr. Emeka Oko, who is the PRO of Nigeria Medical Association Edo State Chapter, coming here to educate people on fibroid. That's been the show today. My name is Blessing H, and next week will be another time for Healthy Living.